Welcome to our conference, Jason. Could you introduce yourself?
Sure. Thanks, Jen. Jason Bock. I'm CEO of CTMC. We are a joint venture between MD Anderson Cancer Center and National Resilience, helping to accelerate cell therapies reaching more patients.
Where did you hear our conference, and what's your experience so far with this conference?
I've worked in the Philadelphia area previously. I was site head of Teva's Innovative Biologics site in Westchester, Pennsylvania, and actually participated in an earlier SAPA annual meeting, maybe about 6 years ago. And fortunate enough to work with several of the organizers who invited me to present at this year's Cell and Gene Therapy Conference.
Thank you, Jason, and welcome back to the Philly area. Has anything changed since you left?
Seems like it's warmer.
It is.
No, but I would say, when I moved to Houston about 5 years ago, I think cell therapy was just sort of a little bit of a buzz, getting a little bit of excitement. It's amazing to see in especially the Philadelphia area how profound the impact of cell and gene therapy has been on the area. It's a tremendous conference, fantastic attendance, great discussion, mostly from all the excitement around Philadelphia area about cell and gene therapy.
Yeah, we'll come back to the Philly and bring your insight in the future directions for the cell therapy. It's a brilliant talk, and I really admire the vision on the cell therapy development, especially for the business models you are working on. So could you elaborate it a little bit on what's the business model for CTMC?
Sure. Well, we try to think of where are the challenges in the field, especially for companies to get their products into the clinic, which is a very different supply chain than you have for traditional therapeutics like small molecules or antibodies. And so we solve that problem for companies in terms of creating a connected interface between the number one cancer center in the world and industrial manufacturing for cell therapies, and handle all of the logistics for companies between those. And so by simplifying how a company takes a product from research stage into the clinic and doing it at a very high level, we bring down a lot of the cost for the company, and they're able to then really have a very tight partnership with us. And so for every product we work on, there's some amount of shared downstreams where we share some of the risk and we share some of the reward if the product works well.
Right. Yeah, I can see how benefit it is to working in one site with everything there and all the expertise in the clinical, all the doctors there working on the cancer. What type of cancers have you worked with, and what's inspire you, make you feel very excited day-to-day work?
It's almost easier to talk about the cancers we don't work on than the ones we do. But melanoma, leukemia, lymphoma, both B-cell malignancies and T-cell malignancies. We have a trial going on in renal cell carcinoma. We're about to set one up in colorectal cancer, lung cancer. So basically, everything you can think of. I think the thing that's most exciting for me, I've been in drug development for well more than 20 years now. It's always exciting to get new products into the clinic with the potential of impacting patients, and then hopefully moving those through clinical development to get to commercialization. What's amazing about cell therapy is that even in patient number one, you can see responses. And so some of the trials we've done, the first patient we've enrolled in a brand new therapy who is a terminal cancer patient who has no other options, they responded, sometimes a complete response, and have their life back for a period of time. That's what motivates us, is we can literally see the hospital out our window and know that the patients who are getting the treatment are just a few blocks away.
Yeah, it's really exciting. Like, patients is our goal, right? So we want to cure the patient and release their pain. That's every people working in the drug industry's goal.
Sure. Yep.
Yeah, I think that's very motivative, and because, as you know, this year is not an easy year in cell and gene therapy. A lot of biotechs cannot survive because of the economics. One is like the cost of good is so high for gene and cell therapy. And also when you're talking about the transformation, right? So it's not the platform that is transformed, also the healthcare system is also adapting these changes. So what's your insight in how we can negotiate with the healthcare system to bring the cost, like insurance, down while the company can still be profitable making these drugs?
Yeah, I mean, I have some thoughts on that. We don't directly participate in that space. We have a lot of things we do, but we don't play in that space so much. I think if you look at the health economics of cell therapies, and if you're giving single dose cures to terrible diseases like cancer, there's a positive health economic argument to be made for those, even if the therapy costs $400,000 or $500,000, because the patient transforms from a cancer patient who has to come back every month to the cancer center, get more scans, get more treatment, have more days off from work, to somebody like Emily Whitehead, who we talked about, who from 6 years old got a dose of the CAR T, and that was the last cancer treatment she's ever gotten, and has been cured of cancer for the last 12 years. She's not a cancer patient anymore. She's not a burden on the healthcare system. She's a productive member of society who's going to give back. So there's a very positive health economic equation to be made. It is challenging, though, in the American healthcare system, where insurance follows with your employer and for these single dose treatments. And so I think we do have to figure out how to address single dose treatments that are curative in employer sponsored healthcare.
Right. Yeah,
that's one thing I haven't figured out how to solve. Like, I think we've solved a lot of other things, but yeah.
Everyone in this field is trying, and it is a cure, right? As you said, it's a cure, and they are drug-free for the rest of their lives.
Yeah.
It's a game changer in the system. So
exactly.
Really appreciate your time. Thank you for coming to the conference, and hopefully you are gonna enjoying the rest of the presentations and making good connections.
Jen, thanks again so much for inviting me. It's a fantastic lineup of speakers, and I've really enjoyed the conference thus far.
Thank you.
Thanks again.
Thank you.